Good afternoon, chairs, members, and staff. Kim Johnson, California Child Care Resource and Referral Network, and I'll be brief. Just as a reminder, in your respective districts, it's YMCA San Diego, Four Seas of Alameda, and also MAOF, in your respective districts, who are the resource and referral programs in your communities, who have also been impacted by the cuts of the recession. So those programs are the ones that are walking families every day through the experience of helping them find child care and early education programs for them and their child, and are looking at quality indicators in a number of pieces. So I just want to remind us that we do have a strong infrastructure that has also received cuts, but that needs some support to continue to serve in that capacity.
Absolutely. Thank you very much for pointing that out. Anyone else under public comments? All right, I'm going to turn the gavel back over to Senator Block.
Thank you, Senator Corbett. I'd like to thank and excuse the panel that's here today. Appreciate all of the information you were able to give us.
Thank you very much.
We move on now to the last section, which is the Department of Education panel. It'll include representatives from the Department of Finance, Department of Education, and the LAO's office. So will any panelists addressing items 1 through 5 under the last section, 6110, please come forward, have a seat. And again, just reinforce to the members of the public who are here to speak, there will be an opportunity to speak about TK, about California State Preschool, about CSSP family fees, CSPP family fees. At the conclusion of this panel presentation, there will be additional public comment. With that, I'd like to ask that the Governor's Office, Department of Finance, begin with an overview of your budget for this year.
Good afternoon, Jessica Holmes, Department of Finance. I'm here to give you both a brief overview of the 2014-15 Governor's budget and an outline of the state's federal funding for child care. In the Governor's budget, total spending for all child care programs and after-school programs is $2.9 billion, of which about 2/3 is general fund and about 1/3 is federal funds. State child care is made up of caseload-driven programs, such as CalWORks Stages 1, 2, and 3 child care, and programs that are funded as capped appropriations, including voucher-based and direct contracted child care programs, state preschool, and after-school programs. The 2014-15 Governor's budget provides stable funding for all child care programs consistent with current year allocations. The administration continues to fully fund CalWORks childcare as consistent with the intent of the legislature. For CalWORks Stages 2 and 3 childcare, the Governor's budget includes increases of $6.3 million for Stage 2 and $2.8 million for Stage 3. These increases are based on changes in cost per case and caseload. We will update projected costs for CalWORks childcare as part of the May revision, and we're currently working with the Department of Education, the Department of Social Services, and the LAO to do so. For voucher and direct contracted childcare programs, the Governor's budget includes a total increase of $2.9 million, reflecting a slight growth in the state's 0 to 4 population. As I stated earlier, and as the LAO stated earlier as well, state child care programs are funded by a combination of state funds and federal funds. The state draws down more than $1 billion annually in federal child care funding through the Child Care and Development Grant, TANF, 21st Century Community Learning Center funds, and Race to the Top Early Learning Challenge funds. 4% of combined federal child care and development funds and associated general fund state match must be spent on child care quality activities, with additional targeted federal funds also earmarked for quality. In recent years, federal child care funding has decreased slightly, but we'll continue to track federal funding and provide an update in the May revision. Thank you, and I'm happy to answer any questions that you may have.
Okay, thank you. I know the LAO has a presentation to make at the end on a restructuring plan, but any comments on this early part of the Governor's budget proposal?
We had had some concerns regarding the Governor's original proposal with regards to childcare, but as Jessica mentioned, we're working with them to make sure our caseloads and cost of care are good for the final budget.
Okay, thank you. And Department of Education want to comment?
We're also working with the Department of Finance on May revised numbers.
Well, that's great. We'll all work together. Good. Okay, now we'll move on then to the transitional kindergarten issue. And we're going to hear first from Department of Education, your overview of the transitional kindergarten plans, please.
Good afternoon. Monique Ramos on behalf of the Department of Education. Senate Bill SB 1381 of 2010 changed the required birth dates for admission to kindergarten and established the transitional kindergarten program. A child is now eligible in transitional kindergarten in the 12-13 year if they were born between November and December 2nd, in the 13-14 year if they were born between October and December 2nd, and next year in the 14-15 year if they're born between September 2nd and December 2nd. Transitional kindergarten is the first year of a 2-year kindergarten program that uses modified kindergarten curriculum that is age and developmentally appropriate. The focal point of the transitional kindergarten year is social-emotional development. Students learn to identify and regulate emotions, establish and sustain relationships with others, and work in collaboration to achieve a goal. In addition, transitional kindergarten provides English language arts, mathematics, science, social sciences, physical education, and visual and performing arts. As an example, a transitional kindergartner is going to experience math in a concrete, hands-on manner, not in a paper pencil type situation. Currently, there is no there's no statewide curriculum for transitional kindergarten. LEAs are modifying their courses of study to ensure that they are age and developmentally appropriate. Many LEAs are utilizing the California Department of Education's preschool learning foundations and frameworks, which are aligned to the Common Core state standards. Districts have experienced some challenges with the implementation of transitional kindergarten. Some of the biggest challenges have been school facilities. Some school districts did not have classroom space, and some of the classroom space that they did have wasn't necessarily appropriate for the young population. They either weren't equipped with toilets or not near restrooms. Some districts have also faced challenges in finding enough qualified teachers that have early childhood education backgrounds. There have been some parental concerns, transportation not necessarily being available to the school site that offers transitional kindergarten if it's not offered at the neighborhood school, adequate before and after care, school care. And some families were not aware of the rollout date of transitional kindergarten, which will obviously be resolved next year with full implementation. Finally, some districts have expressed unclarity about what it is to modify or have developmentally appropriate curriculum, and the department does provide technical assistance on that. With me, I have Deborah McManus, the director of our Early Education and Supports Division, to also answer any questions.
Thank you. Now I'd like to hear from the LAO's office. Any reaction?
We don't have any comments on this time regarding transitional
Okay,
kindergarten.
thank you. How about Department of Finance?
We also don't have any comments at this time.
Okay, a couple of questions then. First of all, I've heard a lot about the lack of facilities, and you mentioned it in your opening comments. Do we have any studies, details on how severe is the lack of facilities? Is that significant enough to put brakes on the program?
We don't have any information at this time about the need for school facilities, particularly related. I know that Assemblymember Buchanan does have a state bond bill, and the superintendent is a co-sponsor on that bill, and so that is something coming down the pike to look at addressing larger facility issues across the K-12 spectrum.
But of course, it wouldn't impact if we start up universal TK next year. The bond probably wouldn't see construction for years down the road, I assume.
I mean, it would take probably a couple of years for those facilities to at least be built.
So two options. One, is it a false concern that I've heard, but maybe it's not really a concern? If it's not a false concern, what are the plans? Are we going to rent facilities? Is there a budget item to rent facilities?
I don't think it's a false concern. I think that LEAs do have concerns about it. I mean, there are the ability to rent facilities. So I'm assuming you're kind of referring to the transitional
Right.
kindergarten bill. So there is the ability for, it's a phase-in approach, and the bill also has the ability to contract with local contractors, and there is the ability to basically purchase portables as well.
Okay, okay. Any thoughts about the ideal adult-to-child ratio in a TK classroom?
I'm going to let Deborah actually answer that.
Thank you. There's several different standards for quality that are used, excuse me, for serving 4-year-olds. The licensing requirement, which is Title 22 that you've heard about, is a 1-to-12 ratio for serving 4-year-olds, so 1 adult for every 12 children. Head Start has a 1-to-10 ratio with a maximum group size of 20. And our own state preschool programs have a 1-to-8 adult-child ratio with a group size of 24.
Okay, and we've talked about ADA funding in terms of how we fund this, and I assume there'll be money built into the budget based on ADA funding. I have heard from some of my districts, I have a couple of basic aid districts in San Diego who don't receive ADA funding. How will they be funded? Have you given thought to that? I mean,
We're going to have to follow back up with you with that. I don't have an answer to that today.
okay. All right. Okay, thank you. Senator Monty, any questions?
I'm glad you asked about the
Okay. Moving on then from transitional kindergarten, let's go to the California State Preschool Program and hear from CDE about that.
Just a little bit of background. The state preschool program was essentially created in 1965 with the goal of providing an educational experience to low-income children. Preschool underwent a major transformation in the 1980s, with its new goal being to prepare students to succeed in school and required the Department of Education to establish standards and quality. Finally, in 2008, several programs that served 3- and 4-year-olds were consolidated into the state preschool program, which now provides preschool for 3- and 4-year-olds both in full and part day. Today, all preschools agencies that contract with the Department of Education must meet our Title V regulations that require quality standards that exceed the licensing care standards. The Title V standards have staffing ratios, so 1 teacher to every 24 students and 1 adult to every 8 students. So in a classroom of 24, this is 1 teacher and 2 adults. The preschools are educational programs that are developmentally, culturally, and linguistically appropriate for the children served. And we have the curriculum and instructional materials that are aligned, have to be aligned to the California Preschool Learning Foundations and Frameworks. The foundations outline the knowledge and the skills that children will be receiving, and the frameworks provide strategies for early childhood educators. As I mentioned, these are aligned to the Common Core state standards. There's also staff qualifications and professional development that are utilizing the Commission on Teacher Credentialing's Child Development Permit Matrix, which does require continuing educational hours. There's parent engagement and educational components that require but are not limited to parent orientation and at least 2 annual parent conferences. There is a desired results assessment system for the purposes of providing individual and classroom instruction. The system is aligned to the foundations and the frameworks and is designed to show progress of the children and the families in reaching their individual goals. This is an observational assessment, not a paper pencil or technology-driven assessment. Finally, preschools provide meals and snacks for children, as well as parent education, referrals to health and social services for families when necessary. I do briefly want to touch on the California Race to the Top Early Learning Challenge Grant because it does impact preschool. California received a $52.6 million grant. Nearly 75% of those funds have gone out to 16 local consortiums that voluntarily participate. Those local consortiums must implement their own quality improvement rating systems that do contain 2 state-wide common tiers. And for state-level work, the Department of Education, the State Board of Education, the Department of Social Services, the Department of Public Health, and First 5 California are working together on outcomes that involve teacher and provider training and professional development, kindergarten readiness, community care licensing, home visits, developmental screenings, evaluating those local quality improvement rating systems, and finally building sustainability for continued local support.
Okay, thank you. Now I'll turn to LAO and Department of Finance. Any comments on this? None? None? Okay, then I'll ask you a question. The proposed TK for All, how will that impact the existing California State Preschool Program, if at all?
So the current proposal would allow LEAs to contract with current providers. The vast majority of state preschool providers that the department contracts with are actually through LEAs, and many of those LEAs then subcontract out. But it does still provide state preschool for our 3-year-olds.
And will there be more funding or less funding available, or will it be neutral, do you anticipate?
So at this point, I mean, the bill doesn't address funding at this time, so.
Anyone else have thoughts on that? No? Okay. All right, we'll hold that question. And we're going to hold this open anyway till we get more information. Any further questions on the state preschool program? Seeing none, we'll move on to item number 4 under Department of Education, which is the CSPP, or California State Preschool Program, family fees. Do you want to tell us about that?
The California Department is collecting data on the impact of family fees charged to Part Day preschool for the first time this year. Preliminary data as of December 2013 shows about $6 million have been collected from families in Part Day preschool. If this number were to annualize, it would be much less than was originally estimated when the item was passed in 2012-13. The department has also surveyed its contractors and has anecdotal information about the impacts of family fees. Contractors and and providers are reporting that they believe the new family fee is impacting parents' decisions to enroll and stay for an entire year. Contractors report that it's impossible to determine if families are not deciding to enroll because of the fee, because these families are just not showing up. Some contractors have stated that low-income families are not being enrolled in state preschool because of the family fees, so they are serving families with higher-end incomes. Although this may be the case in some areas, data at the statewide level does not support that as a state trend. Contractors are also reporting significant workload increases due to the assessment of fees. In school districts, business officers are frequently the ones who are collecting the fees and may not have experience with the calculation of the fee or payment plans. For small contractors, it may be the teacher that's collecting the fee, and that can have an impact on the relationship between the family and the teacher. It's also impacting classrooms. Stability is incredibly important, and when children are leaving because families are unable to pay those fees and a new enrollee is coming in, it can impact the entire classroom, not just those individual children. Last year's budget bill, Assembly Bill 86, authorized the superintendent to establish a new fee schedule that's simpler and easier to implement. In collaboration with stakeholders, the department has developed the proposed fee schedule that would convert daily schedules to monthly fees. The fees will be assessed on a total monthly hours versus daily hours. The fees will be based on the number of hours that the family needs per month. If the family's needs change, then it will be on the average hours used or of anticipated use. Families will be assessed their fee upon initial enrollment and will only be updated when the family need is updated or recertified. Families will be assessed a full-time fee when they receive services for 130 hours or more a month, and will pay the part-time fee when those services are less than 130 hours. The department anticipates providing Department of Finance with the new fee schedule within the next 2 weeks for approval, and the fee schedule is supposed to be released for full implementation July 1 of 2014.
Okay, thank you. Does LAO have a comment on the new fees proposal versus the current proposal?
We do have a couple comments on the Part Day preschool fees, if that would be okay. So actually, the Part Day preschool fees to date have been the state has collected more than anticipated. Originally, it was thought that we would collect $3 million. So the state's only partway through the school year, and we're at 6, and so there are still more months for which to collect fees. Moreover, I just want to comment on the question of which families are paying the fees, who's enrolling in this program. So one of the concerns raised by the field has been that the lowest income families aren't accessing the program any longer because of the implementation of fees. If we compare the income of families participating in the program before the fees were implemented and today with the fees implemented, we actually don't see a difference in who's accessing the program. That isn't to say that these fees aren't a barrier to some families and they aren't able to enroll, but that the families that are actually receiving services are some of the lowest income families, and the program continues to serve them. And we do hear similar things as the Department of Education with regard to the difficulty of implementing the fees at the local level. We have heard some of those concerns. But we would just like to emphasize that the fees more generally are a trade-off. The fees support additional slots for additional children to be served. So if the state were to remove the fees, it would mean that we would no longer, if there were no new general fund monies put into the program, we would no longer be able to support the slots that those fees are actually supporting today.
And how much general fund money would be needed to totally supplant the need for these fees?
Well, so the fees collected to date are about $6 million. Likely that would double or more over the course of the year, so somewhere around $12 million.
Any comment from finance?
I'd like to echo what Carolyn said about we are actually taking in more fees than we expected. In terms of general fund backfill, the fees go towards local, as we understand, it goes towards local slots. So it would be a policy decision as to whether or not to backfill those funds if the fees were removed. We are looking forward to receiving the new fee schedule from CDE, and we'll definitely be analyzing it when we receive it.
Great, thank you. Mr. Monning, Senator Monning.
So on page 30, the table 6, the fee setting by family size, I assume the number in family size, if it's family size 3, could that be 2 adults and 1 child, or 1 adult and 2 children? Is it the family size is the total number adults and children?
Correct. It could be either.
But it doesn't make a distinction. So a family of 4, it could be a single mom and 3 children. They would pay the same fee as a family with 2 adults and 2 children.
That's correct, assuming that the family income is the same.
Right. And so it's really, the real function is looking at the income, whether there's 1 or 2 adults in the family, right?
That's correct.
Yes, and I would just add that the fees are maximums per family, not per child enrolled in the programs.
So that's a helpful clarification. So if there's 1 child or 3 children, it's the same fee.
Correct.
Thank you.
Thank you, Senator Monning. We will move on now to the final point in item 6110, the LAO restructure proposal. We'll turn to the LAO for this.
Okay, so I believe the sergeants are handing out a 1-page handout that we have to go along with our report that's in your binders. It has this teal cover. Our office recently released a report that lays out really a soup-to-nuts restructuring of the child care and development system in California. The first thing I'd like to note about the report that we just issued is that it's fiscally neutral. All of the recommendations in the report could be implemented without affecting the number of children served or the money dedicated to the system. That's not to say that there aren't places to make new investments to rebuild the child care and development system, but rather that the report leaves it up to the legislature as to which area it wishes to prioritize in the overall system. So if I may, I'll first go over what our main findings were at a very high level, and then our key recommendations also at a high level, but I'm happy to answer any more specific questions that you may have about the report. So in assessing the child care and development system, as I mentioned earlier in the overview, we found that the child care and development system has some serious design flaws. Particularly, we identify 4 that we believe are most critical. The first is that some families are guaranteed access for many years of services, whereas there are other families who never receive services at all. So by that we mean those families who come into the CalWORks door are guaranteed services for 13 or more years, whereas those families who never participated in CalWORks may never access child care services due to the long waiting lists and relatively higher income compared to their peers. The second flaw we identify is that similar families have a different amount of choice in selecting care. By that we mean those families who receive a voucher can pick any provider in their community that meets their needs, whereas those families who receive a contracted slot can either utilize that slot or will not be able to access subsidized services. Now, the flip side to that is those families, and the third flaw we've identified, is that those families who receive contracted slots are the families who have access to Title V programs, which are the programs that have the educational component to the care, whereas those families who receive vouchers are not guaranteed that the care will include developmental and educational components. The last flaw that we identify is based on the reimbursement rate structure we have for these voucher and contracted slots. Particularly, the state pays a higher rate in 19 counties for the voucher programs, which are not required to include developmental components to the care, than it pays to the contracted programs, which are required to include the educational components. This is particularly troublesome because in 9 of the 15 most populous counties, we have this inversion of the reimbursement rates where we pay more for less, and this is where we serve the vast majority of children across the state. So as a result, we recommend the legislature consider a fundamental restructuring of the child care and development system with 4 key characteristics that we lay out in the proposal. First, we recommend allowing more families to access the system by instituting a time limit. We recommend the state continue to prioritize families new to CalWORks because these are our most vulnerable families that we want to engage in the workforce, but to limit all families, both CalWORks and non-CalWORks families, to 6 to 8 years of subsidized child care in order to be able to serve more families across the state. We estimate that by instituting this time limit, the state could serve on the order of 35,000 additional families over time. The second characteristic of our proposal is to provide families similar levels of choice by over time providing the majority of subsidy through vouchers. This would be a gradual transition away from contracts as the system would increase capacity in the educationally enriching programs, which goes to our third characteristic, which would be to require developmentally appropriate care for children birth through age 4 in all programs. So any family that received a voucher and used that to access a provider in their community would be guaranteed services that included developmentally appropriate care. And lastly, we recommend the legislature update the reimbursement rates to reflect the higher standards of care for these children birth through age 4. In our report, we also include a roadmap by which the legislature could consider moving to this new system. We don't envision this system happening overnight. It would be a multi-year, multi-step process, and we provide some detail as to what that could look like. So I welcome your questions.
Yeah, this is a very thought-provoking report and lots of good ideas. At this particular stage, I guess it just came out in the process, there doesn't seem to be a lot we can do immediately from this, although long-term there's a lot of good information here. Is there anything you would take that could be applied immediately this year's budget process?
There are a couple of steps that we identify that could be done in year 1. So the first step, for instance, that we identify is that we could update the reimbursement rates to just be honest about where we are relative to current prices. So as I mentioned in my overview, we haven't updated reimbursement rates since 2005 and 2007 respectively. We could update those reimbursement rates using a simplified reimbursement rate structure that we talk about in the report. And we estimate that using that simplified reimbursement rate structure, we could actually move to the 70th percentile of the most recent survey. So that means in a county where there are 100 providers, a family would have access to 70 of those providers. So that's one step we identify that we believe could happen in the first year.
And what would be the cost, total cost of doing that?
There's no cost to moving. We estimate that there would be no additional cost to moving to that simplified reimbursement rate structure.
So we'd be reimbursing the same amount, just changing?
It would do two things. One, it would move away from the reimbursement system we have now that's based on 58 distinct county rates, and instead using 3 levels: high-cost counties, medium-cost counties, and low-cost counties, and then updating the rates based on the most recent survey, but it would be cost neutral. So we would simply say, in 2005, we said we were paying at the 85th percentile. If we use the 2012 survey, we're actually paying at the 70th percentile.
Okay, thank you. Okay, I appreciate that presentation. That concludes our panel discussions. We now have time for public comment. And at this point, public comment is appropriate on anything we've heard in the second portion of the program. So that's on the governor's budget, on transitional kindergarten, on the state preschool program, on family fees, or for those who are already familiar with it, with the LAO's restructure proposal. I want to again thank the panelists from Department of Education, Department of Finance, and the LAO. I want to remind all presenters that you will have just 1 minute per presentation, so don't bury the lead. Get right to the headline, the most important part of what you want to tell us. At a minute, you'll be cut off. So come on forward. And actually, in the interest of time, you can fill up the chairs here, the 4 chairs in front of us, as well as the mic at the podium. And then once one person is done, you can begin to speak going across from left to right. So you'll be first, you'll be second, and so on, going from left to right. We've got one more empty chair here. And then as people finish, they'll head to their seats, and other people will fill in behind them. So when you do speak, please state your name, if you represent an organization, what organization you represent, and then take your minute. Thank you.